So what I want to do is I want to provide you with the opportunity to have more of the in-class experience that we usually have with anatomy. Also want to make sure that we go over some of the concepts that we have gone already over previously in the readings and in the slideshow presentations. Where I'm going to do a couple demonstrations with the bones, also do a couple demonstrations with the drawings as well. As you can see, I have the board up. We'll definitely do some drawings. So I want to make sure you take full advantage of the time, and definitely feel free, pause the videos, get up, get moving, do what you have to do, and that way we can pay attention, and that way we can have a really good session. So first thing I want to discuss is this concept of Genu, varum, and Genu valgum. So Genu just means knee. So think about the words genuflect, geniculate, all those start with G-E-N-U. That is the prefix for the knee. Genu varum is a situation where, and what we have here is we have my femur, and obviously we have my tibia and fibula. Genu varum is a situation where we're going to have a gapping at the lateral side. So you can already kind of see what happens here. If I pull my lateral femoral condyle, my lateral tibial condyle apart, you can see exactly what happens. My knee now goes into almost a bow-legged position, or what's called genu varum. What I really want you to think about here is I really want you to think about what structures would get tight, what structures would get loose, how somebody would present with this, and then from there really start thinking about what implications would I have at my hip, what implications going forward am I going to have at my foot and my ankle. Because like I said earlier, all these concepts are going to build on each other. Now, moving on to genu valgum, what's going to happen is the opposite. The medial aspect, the medial femoral condyle and the medial tibial condyle are going to gap, or they're going to have tensile forces placed on them. Also think about what's happening here at my lateral femoral condyle and my lateral tibial condyle. Obviously what we see here is that there's compression on the lateral side, gapping on the medial side. This, in layman's terms, is what's known as knock-kneed. Okay, so what we see with genu valgum is that in individuals, knees will touch before their feet or their ankles will touch if they're trying to put their feet together. So again, think about what structures would get tight here. Think about what structures would get loose. Think about what structures would have compression forces placed on them abnormally. Also, what structures would have tensile forces placed on them abnormally. So I definitely want to make sure that you're comfortable with those. Definitely want to make sure you understand those going forward, because they're going to have a lot of implications all the way up and down that lower chain. So we're going to have to see implications at the pelvis, at the hip, at the knee, obviously, at the foot, the ankle. Okay, so I want to make sure we understand these concepts. Like I said earlier in the course, these concepts really are going to build on one another. So next point I want to make, I'm going to move over to the drawing here, is we're going to start talking about the popliteal fossa. Now what we're going to see with the popliteal fossa is that we're going to have 4 borders. Okay, so what we're going to see is that this is going to be, I'll write it up here for you guys. So this is going to be my popliteal fossa. What we're going to see here is we're going to see this is going to be semitendinosus. And it's going to have semimembranosus coming underneath. Because remember, semitendinosus is going to ride superficially to semitendinosus. So this red guy here this is going to be semimembranosus. We're also going to see biceps femoris come down. And those are going to be my medial and my lateral superior borders to the popliteal fossa. Other big group of muscle here is going to be the gastrocnemius. Gastrocnemius is going to have two heads. It's going to have a medial head and a lateral head. So this is going to be my lateral head, gastroc. And then obviously if I have a lateral head of the gastroc, I'm going to have a medial head of the gastroc as well. So these are going to form the borders of my popliteal fossa. In my popliteal fossa, just like we saw with the femoral triangle and just like we saw with other areas of the body with these anatomical areas or anatomical spaces, is that I'm going to have several different structures pass through there. What I'm going to see is I will have a nerve. So my sciatic nerve will come through and it's going to split. It's going to split into my common peroneal or common fibular nerve. And then we're going to see a continuation happen. And this is going to be my tibial nerve. We're also going to see the blood supply come through. So we're also going to have coming through, I'm going to draw this way out here, the popliteal vein. And we're also going to see this red structure in here. And this is going to be my popliteal artery. So what I want you to do at this point is make sure that you pause the video, make sure you understand, make sure that you can replicate and recreate this concept, because this is going to be a very large concept as we start moving into the lower leg. Because just like we saw with the upper extremity, these larger branches of nerves, these larger structures are going to start branching into more and more structures as we move distally. So definitely want to make sure you understand this concept, because everything's going to start getting smaller and everything's going to start having more branches as we go. The next thing I want to move into is the blood supply specifically to the knee and the popliteal space. Now I understand I just drew the popliteal artery in place. What we're going to have to understand is that the popliteal artery is a continuation of the femoral artery. So what we're going to have here, I'm going to draw in, this is going to be my adductor hiatus. So as we know, superior to that adductor hiatus, this is going to be my femoral artery. What I'm going to see is now, inferior to that adductor hiatus, this artery changes name to the popliteal artery, or popliteal artery, depending on what part of the country you're from. As this popliteal artery travels into, now moving into this large space, being the popliteal fossa, it's going to start giving off some branches. Now what I'm going to do here is I'm going to draw in a little hashed line. This hashed line refers to the joint line of the knee. This is very important, because what's going to happen here is my popliteal artery is going to give off branches. These branches are literally named for where they are. So if this is my medial side over here, and this is my lateral side, this branch is going to be the superior medial geniculate. This will continue on and give off another branch. This branch is going to be my inferior medial geniculate. Over here, this is going to be my superior lateral geniculate. Here, this will be my inferior lateral geniculate. Now there are a couple more smaller branches like the intermediate geniculate. Also understand a couple other points. There's a very large anastomosis that happens here, very similar to what we saw last semester at the elbow. Don't necessarily worry about all the anastomosis for the context of this course. The other thing I really want you to be aware of here is that I'm going to draw it in green because the picture is getting a little muddled at this point. But we also have this larger branch that feeds the knee, and this is the descending geniculate. And that's a branch off the femoral artery. So also understand that we have this descending genicular branch as well. So this is how we get blood in and around the knee joint. So what happens is that popliteal artery gives off these 4 branches, and they're going to wrap around, and they're going to supply a lot of the blood to the entire knee joint. So make sure you're aware of that. Make sure you understand how this concept is going to work. Obviously, what I want you to do, pause the video at this point in time, and I want you to understand, recreate this drawing, try to start doing this from memory. I really believe that drawing these structures out really does help out significantly.